you have, again, these very basic health ailments. And it's not just polio, right? The World Health Organization has reported tens of thousands of cases of lice and scabies. These are easily treatable. Thousands of cases of rashes. Over half of the population has reported respiratory infections. You have very high reports of acute diarrhea, which for children under 5 can be quite lethal. You have tens of thousands of cases of jaundice. I mean, I could really go on and on. And the really tragic part of this is that by themselves, none of these need to lead to a health emergency. And yet the conditions that Israel has created and enabled and continues to create with the permission really of much of the world will cause significant unnecessary suffering, disability, and death for people, largely because there is no capacity for people to receive care, from advanced traumatic injuries like amputations to something as basic as lice.
Hi, I'm Yumna Patel, Palestine News Director at Mondoweiss. This is the Mondoweiss Podcast. In mid-July, reports began to emerge from the Gaza Strip that polio was detected in the water. Days later, the Gaza Ministry of Health declared a polio epidemic and called for immediate intervention to end the Israeli aggression and find radical solutions to the worsening public health crisis in the Strip. The World Health Organization said it would send more than 1 million polio vaccines to Gaza to be administered over the coming weeks to prevent children from being infected. But whether Israel would open up the borders to allow the vaccines in remains to be seen. In this episode, I speak with Yara Asi, a Palestinian public health expert, on what consequences this latest development could have, not just for public health in Gaza, but for the world, where most strains of the polio virus had effectively been eradicated until now. Yara Asi is an assistant professor at the University of Central Florida in the School of Global Health Management and Informatics and co-director of the Palestine Program for Health and Human Rights. Her work has been featured in peer-reviewed journals as well as the New York Times, The Nation, The Washington Post, and others. She's also the author of How War Kills: The Overlooked Threats to Our Health. Yara, thanks so much for joining us.
Thank you for having me, Yumna.
So, as we enter into 10 months of Israel's genocidal war in Gaza, the situation on the ground continues to grow more desperate, particularly when it comes to the public health situation in Gaza. News has been circulating of a polio outbreak, and the Gaza Ministry of Health just announced that there was a polio epidemic in Gaza. Can you talk about what you know of this spread of polio in Gaza right now?
Yeah, this is a great and really important topic. You know, the spread of polio is something that we hope not to see anywhere, and yet we know is most likely in these types of really fragile and complex humanitarian situations, as we see now. So polio is a very contagious infectious disease. It's a virus, and it basically destroys the nervous system and can cause paralysis. We saw polio outbreaks during the Syrian war multiple times, and essentially since late October, public health experts, including in Gaza, were warning that if the humanitarian situation continued to deteriorate, this was not an improbable outcome. This could happen. And so now, as you say, we're 10 months in, and in about mid-July, we started to hear reports from the Gaza Ministry of Health that they were detecting polio in the wastewater. So I want to first emphasize just how impressive that is, because the disease surveillance system in Gaza, much like everything else, is almost completely destroyed. So the thought of these workers still trying to gather these samples and do these tests so that they could find that there was polio potentially circulating before we started to see multiple cases of paralysis, especially in children, is really an astonishing public health success. So we, like I said, we're really worried about this, because prior to October 7th, and really for multiple decades since the late 80s, there was massive immunization campaigns around the world to prevent polio. And polio is almost entirely preventable with vaccinations. That's part of what's so devastating about this. This is completely predictable, completely avoidable. So Palestinian vaccination rates for polio across the territories was about 99%. since October 7th, because there's been thousands of babies born and many children who were very young and perhaps received their first or second dose, but not the full course. Now that rate has already dropped to about 86%. This is incredibly low. We have thousands of children missing all sorts of routine vaccinations. So the IDF recognizes that this is a problem because we heard that they began a campaign to give polio boosters and vaccinations to the soldiers that are serving in Gaza because they don't want them to return to Israel and spread polio there. So as you said, as of late July 2024, the health ministry in Gaza declared a polio epidemic. The good news is that so far, there have not been cases of paralysis reported, as I noted. That does not mean that they don't exist. So there has been a communication blackout in many parts of Gaza. Many families are completely displaced. They're not exactly in contact with health authorities. Many hospitals and health clinics are shut down, destroyed, non-functional. So it's not impossible that there are cases of paralysis that simply haven't been reported yet. And what we know is the World Health Organization is incredibly concerned about this because, again, polio is highly contagious. It does not respect borders. It does not respect race, ethnicity. It simply spreads. And so the UN has reiterated multiple times their call for a ceasefire, at the very least to allow for a mass vaccination campaign. This is not a certain outcome. This could be still prevented at this point, but they need to be able to get vaccines in. They need to not just get them from outside of the border to inside, but they need to be able to travel safely throughout Gaza to find pockets of the population and give primarily children this vaccine. So the Secretary General of the World Health Organization has called for this. And as far as we know at this stage, there has been no indication that Israel is interested in pursuing a ceasefire, even for vaccinations, which is something we saw even in Syria during the height of the war. Ceasefire for vaccinations, even temporary.
I want to get more into the implications. As you mentioned, there are devastating and vast implications that this could have, not just for Gaza, but for everybody around the world. Before we get, I want to go back a little bit to just inform people who aren't familiar. What are the material conditions that lead to polio outbreaking in a place, anywhere, but in a place like Gaza? What conditions, create the emergence of this virus?
Yeah, so typically this is spread through water and through access to unsanitary conditions. So we know that there's almost no possibility for proper garbage disposal in the Gaza Strip. There's certainly no hygienic products, even soaps that are being really distributed. So you have this very unsanitary environment. You have little access to water, and what water people do have is often dirty. So we're hearing of people, washing their children in the sea, or simply, living among what are essentially, dumps that are now popping up around the Gaza Strip. So children, can access this dirty water, or locations where people are using the bathroom outside, and can get polio that way. And then once it spreads throughout the population, it is, like I said, highly contagious. So it doesn't take much longer of these types of conditions for initial cases to start being reported. And we know that once we see that, we will start seeing many more. The first reports that we actually see in children are an indication that it is really spreading significantly. So, people are homeless. They are crowded in these extremely, as I said, unsanitary shelters. There is a whole host of infectious diseases that we're hearing being spread because of these unsanitary conditions. And people are continuously being forced to move, as you know, from location to location to location. And services are getting weaker and weaker and weaker where those people are moving. So now where they are, there's almost no sewer services. There's no clean water. There's no ability to wash. People are crowded together. This is the perfect recipe for the spread of this type of virus.
And once someone is infected with polio, and you said paralysis is, something that happens once you contract this virus or this disease. What happens after that? I mean, is that a lifelong thing that you have, or is that something that can be cured after the fact?
So the reason we have pushed vaccination so strongly is because there is no cure for polio. There's only treatments to help people with the symptoms of the virus. So this can help people who have been partially paralyzed to regain some level of mobility, but it cannot reverse paralysis. So that is part of why many global health initiatives emphasize high vaccination, high vaccination. This has been a global priority because it's so avoidable and yet it's untreatable. So it's, we heard many dozen cases of paralysis coming out of places like Syria. And now these children, regardless of the trajectory of the violence they're living in, will have to suffer from this for the rest of their lives.
And not to mention the fact that Gaza's health system has been completely decimated by Israel since October. Hospitals have been routinely targeted. There is not a sufficient flow of medicine or other necessary vaccinations or whatever it may be into the Gaza Strip. So, like you said, there's the perfect recipe for polio to emerge, but also to spread rapidly without people even getting treatment. Let's say that vaccinations don't happen, but once people are infected with this disease, it's not like they can go to the hospital and get treatment either.
Yeah, you're right. There is almost no form of care for people aside from really trauma care. And even that is extremely deficient. I mean, I'm sure I don't have to tell your listeners this, but the Gaza health system was starting at a deficit long before October 7th. There were countless reports about the humanitarian conditions, the shortages of medicines, the shortages of hospital beds, the inability of healthcare workers to train. And yet they had managed to put together a robust enough health system that we were not seeing really catastrophic health outcomes. We are now seeing those. We have, like I said, we have displaced and homeless people, lack of water and clean water, these shelters, no sanitation. On top of that, you have, as you said, this completely decimated health system in many ways. I mean, the physical infrastructure of the health system has been destroyed in many ways. You have many hospitals. I think at last count, there was just over a dozen that were just partially functional. Primary care clinics, which is typically where you would take someone for, basic infectious disease control, are almost all gone. And aside from the physical infrastructure, you have the human infrastructure, the human capital, the doctors, the nurses. Hundreds have been killed. Hundreds have been detained after raids of hospitals. Hundreds have been displaced, or thousands, or who knows how many have been displaced with their families and are unable to work. And some have, evacuated to Egypt to protect the lives of themselves and their families. If you are able to get to a health center and you are able to find, the provider to help you, they have almost no resources with which to do so. They have, shortages of things as minor as gauze. They don't have even basic painkillers. We've heard as early as November that people were performing surgeries with no anesthetics. It has not gotten better. Aid flow into Gaza has almost, especially since Rafah has been closed since early May, has really slowed down. Israel has shown no indication that it plans on opening. There's multiple border crossings that could be used to distribute aid. They've indicated they're not really interested in that, of course. And so you have, again, these very basic health ailments. And it's not just polio, right? The World Health Organization has reported tens of thousands of cases of lice and scabies. These are easily treatable. Thousands of cases of rashes that are, that are spread very easily among children that are kind of clustered together. Over half of the population has reported respiratory infections. You have very high reports of acute diarrhea, which for children under 5 can be quite lethal. You have tens of thousands of cases of jaundice. I mean, I could really go on and on. And the really tragic part of this is that by themselves, none of these need to lead to a health emergency. And yet the conditions that Israel has created and enabled and continues to create with the permission really of much of the world will cause significant unnecessary suffering, disability, and death for people, largely because there is no capacity for people to receive care, from advanced traumatic injuries like amputations to something as basic as lice.
Mm-hmm. I mean, just now you mentioned the other host of diseases and infections that public health officials and medical personnel and doctors in Gaza are already starting to see. Polio is just the latest, but a very severe, let's say, escalation in this issue. We've talked about the implications. You've hinted at them, you've talked about them, but I want to ask you, directly, what are the implications of a polio epidemic in Gaza? And to say that this might not even be the worst thing that happens if the situation doesn't change. What are the implications of this, not just for Gaza, but for the wider region and even for the world? You said the WHO is sounding the alarms over this for the potential disasters that it could have for global public health.
Yes, the ramifications of a potential, or at this point, probable polio outbreak in Gaza are, really multifaceted. I mean, let's start with the population in Gaza. You have thousands, tens of thousands of babies that have been born since October 7th. We're already seeing a very high infant mortality rate because of lack of care. These children, many of them are not getting vaccinated. They're not getting their full vaccines. If they contract certain types of polio, they will be paralyzed for life. They will require lifelong treatments that if they stay in the Gaza Strip, there is little capacity to provide, especially if we start seeing numbers in the dozens or, it's not unimaginable to see higher numbers than that, which would be an outbreak beyond what we have seen across the board. So that's just the children in Gaza, number one. Number two, again, viruses, as we learned during COVID-19, do not respect borders. So if polio, through people exiting, humanitarian workers, or others leaving the territory, it could be carried by them and spread into Egypt and spread into the rest of the region. Like I said earlier, Israel is clearly concerned about this because they're ensuring that their soldiers are getting boosters and they're taking care to make sure that their aquifers are protected. Because a polio outbreak, they know, is devastating to a population. So there's really, once we start seeing that type of spread, which we really hope we don't see, we hope we don't see any cases of paralysis at all. We don't know what that will look like because we haven't seen anything like that in many decades because of billions of dollars spent to stamp polio out. Polio eradication campaigns have been among the most successful and well-funded infectious disease campaigns. Polio is a disease that we never have to see again. And so for the children of Gaza and increasingly for the people in the region and in the world, the fact that it is being reintroduced in such a fragile environment where we're only hearing what is being reported. There is so much we don't know about what's happening in Gaza in this moment. It's frankly very terrifying. And that's why I think the World Health Organization has, as you said, really sounded the alarm, because it is naive to assume that this will, A, not escalate within Gaza, and B, has no potential to escalate elsewhere. And again, completely avoidable escalation.
I want to talk about this in the broader context of Israel's genocide in Gaza, which, as we said, has been, we're entering 10 months now. Unfathomable loss and destruction. Tens of thousands of people have been killed. Entire infrastructures, health, education, have been completely destroyed. But a situation like this healthcare, this public health disaster cannot be understated, how much of a role that this has in furthering Israel's genocide. So I wanted to ask you, as a public health expert, how does using public health or using disease as a method of warfare, or let's say letting disease run rampant as a method of warfare, how is that used, and how would this, further Israel's aim of wiping Gaza off the map?
Yeah. So, we have to remember that the spread of disease is been a purposeful part of colonizing forces, throughout history. We've heard of the infamous, smallpox and the blankets that were given to Native Americans specifically for the purpose of spreading smallpox in that population. Now, the definition of genocide includes two components that are, I think, really vital here. One is causing serious bodily or mental harm to members of the group. And the other is deliberately inflicting on the group conditions of life calculated to bring about its physical destruction in whole or in part. So, for obvious reasons, the bombing and the torture and the raids and the attacks get a lot of the global coverage. I mean, this is always how war coverage works. The spectacle of warfare is very easy for people to understand. They see a bloody child, they see a destroyed ambulance. We kind of get what that has to do with genocide. What's less understood is that there's many ways to inflict harm on a population, and preventing that population from having access to healthcare, access to clean water, access to sanitation, forcing displacement over and over and over again, famine in pockets of the population, injuries that need to be evacuated immediately. So we know that there are 14,000 applications for medical evacuations from Gaza, most of which have nothing to do with battle-related injuries. These are people with cancers and, people who need heart surgeries and brain surgeries, 14,000 that are waiting Israel's approval to be able to leave to receive the medical care that they need. Israel has not exactly been, let's say, expediting the evacuation of these people. And so there was that recent Lancet study that came out in, I believe, early July 2024. And although they used a predictive and relatively crude assessment, they estimated that if the current Ministry of Health numbers of about 39, I think at this point, they're saying 40,000 people dead is accurate. From previous wars, we know that every battle-related death can have from 3 to 15 times more indirect causes of death. So malnutrition, injury, maternal and infant mortality. These also cause people to die. And just because they are not due to airstrikes, they're not dropped from a plane, they are part of this military assault. So it is, not really accurate to disconnect the violence from military actions versus the violence from depriving this entire population, again, most of which are, under the age of 18, of any need, any factor that is needed to sustain life. I mean, we're not even talking about the ability to thrive, the ability to grow, the ability to be healthy. We're just talking about not dying, not living in misery and disability. And these conditions, as has been reported from humanitarian agencies, again, since basically immediately after October 7th, are doing exactly that. Many humanitarian agencies have broken their own guidelines about, political involvement to call for a ceasefire simply because the humanitarian situation is so catastrophic. So we need to see this as a holistic process that 10 months in, it's very hard to argue is not purposeful.
Mm-hmm. In the short term, you've talked about how immediately a ceasefire needs to happen so that some of these immediate concerns can be addressed. But I want to ask you short term and long term, because as you mentioned, there are devastating consequences of this for public health in Gaza for years to come, potentially. What needs to happen to alleviate this immediate humanitarian disaster that's being caused by Israel in the short and the long term?
The problem is we are to the point, and we're past the point. I think I was saying this in February and March, where a ceasefire is going to end suffering for people. Yes, we might not see the bombings so much. We will see the ramifications of this for months, years, generations. Children who have gone through the last 10 months without proper nutrition, they may have stunted growth forever. People who have lost children who have lost parents. We've heard about orphans. Famine, the long-term effects of famine. What is that going to do to this population? The spread of disease is not going to stop the day of a ceasefire. That's going to take weeks, months, again, potentially years to get under control. Most of these people have no homes to return to. Hospitals are incredibly expensive to rebuild, especially with adequate material. And that's if Israel allows adequate imports of what it takes to rebuild. It's going to take years simply to clear the unexploded ordnance from around Gaza. There's estimates that there could be tens of thousands of unexploded bombs and other ordnance that need to be cleared before we can even think about clearing rubble, before we can even think about rebuilding. Where are these people going to go in the meantime? Tent cities? Those are also incredibly unhealthy and dangerous settings for people. And if we're talking about, this for years, I really struggle to capture how devastating this is for Palestinian life, the Palestinian psyche, for the people who are in Gaza now, even those who have evacuated, many of whom are stuck in Egypt with no papers. I know many physicians and medical students who evacuated to Egypt. They can't practice in Egypt. They can't go anywhere else. They're not allowed to basically leave Egypt and enter other countries. What is going to happen to them? We keep hearing about, a ceasefire, and that's incredibly important, but there are so many factors that will be required to get to even a baseline of an acceptable standard of living. And again, this is 2 million people. This is not 1,000 people or 5,000 people. Where are they going to live? Where are they going to get medical care? Who is going to pay for it? We don't know the answers to these questions, and the international community has been content to ignore them. This was bad enough 2 months in. We're now 10 months in. The potential for a ceasefire seems essentially further than it has been throughout this entire process. What if this lasts a year? What if this lasts longer? We are really in uncharted territory, even with regard to the Palestinian struggle. This is, I've heard this is not incomparable to the Nakba itself. Mass displacement, death, disease, and a completely uncertain future. I can't capture how catastrophic this is to health, life, thriving, surviving in the Gaza Strip.
Well, Yara, thank you so much for joining us and for that very sobering reminder of the reality that faces us right now in Gaza and the desperate need for things to change immediately. Yara is a Palestinian public health expert and an assistant professor at the University of Central Florida in the School of Global Health Management and Informatics. She's also the author of How War Heals, the Overlooked Threats to Our Health. Thank you so much.
Thank you for having me.
That's our show. Mondoweiss is a non-profit publication with no paywalls. If you would like to support our work, please go to mondoweiss.net/donate. Please leave a rating and review to help other listeners find the show. Subscribe to one of our free email newsletters so you can stay up to date on events in Palestine and related politics here in the U.S. and around the world. Finally, if you have any more feedback, send me an email at dave@mondoweiss.net. Thanks for listening. We'll be back soon with a new episode.